Have you ever wondered what celiac disease is and how that's different from gluten intolerance? Hi, my name is Dr. Samir Islam, and in this video, I'm going to explain to you what celiac disease is and how that's different from gluten intolerance. Let's begin. So what is celiac disease? Simply explained, celiac is an autoimmune reaction to gluten. It should not be confused with a simple intolerance to gluten. When you have a gluten intolerance, you actually don't have an autoimmune reaction against the small intestine, so you actually don't have any small intestinal damage. Symptoms from gluten intolerance are very similar to celiac or even IBS and include things like bloating, pain, diarrhea, upset stomach. There are no diagnostic tests for gluten intolerance, unlike celiac disease. The way we suspect patients that have gluten intolerance is that if you ingest gluten and you develop the symptoms such as bloating, pain, and diarrhea, and then you stop taking gluten, those symptoms go away, that can be enough for us to tell you that you have gluten intolerance. Now, the treatment for gluten intolerance is that you have to avoid gluten, very similar to celiac. But the important thing about gluten intolerance is that you don't have to be as strict with your diet as you do with celiac disease. Additionally, you don't have to avoid the other things that contain gluten that are not foods, such as lotions, makeup, and medicines. They contain gluten. Typically, you will not be affected if you have gluten intolerance. Thank you guys for watching my video. If you have any questions about whether you may have celiac disease or you're concerned you may have this condition or even gluten intolerance, I would encourage you to call my office for an appointment. We're more than happy to help. Thanks and take care.